Hello, our topic today will be regarding retail clinics' current status in the U.S. This is by Tiffany Quach, Alexander Odell, and Jordan Kovacs. We will be starting a small overview video.
You're sick. You feel terrible, and all you want to do is get better. You call your doctor, but it's flu season, and guess what? Everyone else is sick too. And the next appointment is 3 days away. Rats! Well, we've got good news. There's another way to receive quality health care right when you need it. Retail health clinics. These walk-in facilities are located in pharmacies, grocery stores, and shopping malls across the country, and they're spreading fast. Retail clinics are staffed by certified nurse practitioners and physician's assistants who provide high-quality healthcare services for tons of symptoms. Millions of Americans have visited retail clinics to receive treatment for basic, non-life-threatening illnesses and injuries, such as the common cold, sore throat, poison ivy, acne, and much, much more. You can even visit them for sports physicals, flu shots, vaccinations, immunizations, and even diabetes treatments. People love the convenience of retail clinics. No appointment is necessary. They open early in the morning, close late at night, and are even open on the weekends. And since most retail clinics have pharmacies right on site, you don't need to make another trip to fill a prescription. Best of all, retail clinics are affordable and can help you no matter if you have health insurance or not. Their menu-style pricing shows you exactly what your treatment will cost. If you have insurance, you'll typically just owe a copay like you would in a doctor's office. If you're uninsured, or if the clinic isn't in your health plan's network, you can pay by cash or card. And prices are significantly cheaper than visiting an urgent care center or an ER, which will make your wallet feel healthier too. Whether you're a working professional with clogged sinuses, a busy parent who has kids with earaches, an uninsured patient or high-deductible health policy holder, or just someone who needs quality care in a hurry, retail clinics could fit well as part of your annual plan to get healthy and stay healthy. You can find the retail clinics closest to you at getmehealthy.com, and make sure you leave a review about your experience for others to see.
A retail clinic is a clinic located inside of retail stores, supermarkets, and pharmacies. These include walk-in clinics, such as those found in grocery stores and urgent care centers. Many different professionals work in these clinics, such as physician assistants, nurse practitioners, and many others. One retail clinic you may be familiar with is the CVS Minute Clinic or Walmart's Care Clinic. These retail clinics began to popularize in 2001, which all started with the founding of the Minute Clinic in Minnesota. Retail clinics are often confused with urgent care centers, but they both provide different types of services. For many people, going to a retail clinic can be much easier than trying to schedule an appointment with a primary care physician, and almost always cheaper. Retail clinics have certainly had their benefits, such as very easy to get into, such as no appointment is necessary to be seen. The services offered by retail clinics are usually much cheaper, and the price for each service is set prior to your visit. The price for these services can usually be seen on their website beforehand, and retail clinics accept private insurance as well as Medicare. Some of the services and treatments include treating sore throats, allergies, colds, headaches, and health screenings such as a TB test and vaccinations. Retail clinic popularity has certainly increased over the years. As the delivery of healthcare evolves, we are beginning to see more and more retail clinics emerge from all over the country. But why is that? Retail clinics can be very cheap to open and operate compared to a standard hospital or doctor's office, and can offer many of the same services for less. One of the factors leading to the boost in the quantity of retail clinics is due to the increased amount of nurse practitioners' ability to work as the primary care provider in the clinic. Retail clinics do not need to have a physician on staff, which makes it much easier to open a clinic at a cheaper cost. In the early 2000s, there were less than 30 retail clinics nationwide. When consumers began to take note of the conveniences of these quote-unquote dock-in-a-box locations, their popularity began to rise, as well as the number of clinics across the country. By 2017, there are 2737 retail clinics located across the country, making 35% of the urban population in the US no more than a 10-minute drive from a clinic. Now let's talk about costs associated with retail clinics. On average, a visit to a retail clinic will cost around $78, and patients will have to pay a $26 copay. Retail clinics accept most health insurances, and as well as Medicare. Pricing for some of the most common services, including $65 for a TB test, $89 for a general medical exam, $50 for a flu vaccine, and around $100 to $129 for a blood pressure and cholesterol examination. Another type of retail clinic is urgent care centers, and I would like to talk about the benefits of urgent care centers. Urgent care centers are open longer than typical office hours. The people who visit urgent care centers experience shorter waits to be seen and serve on a first come, first served basis. The urgent care centers include casting, burn or wound repair, and many other services. Another benefit is that payments and copays for treatment are typically lower than those at emergency rooms, which would be the primary care for those in these out of office visits. It has been estimated that 56.7% of all patients seen in the urgent care center use that setting for non-surgent needs as well as their primary care concerns. As we've mentioned before, retail clinics were very small in popularity in the early 2000s. Evidently, this is the image of a 2014 map of the United States regarding the amount of retail clinics in each state. As the blue gets darker, that is evident in more of abundance of retail clinics available in that state. As you can see, there's a huge increase from just about 30 retail clinics in the beginning, and now there's over 2,000 clinics available for urban populations and rural populations. As we've mentioned before, urgent care centers are a type of retail clinic, but there is a big difference between the two. The main difference between retail clinics and urgent care centers are the type of care in which they provide. Urgent care centers are like the name. They're for urgent care, for critical care, that emergency type of care. However, they are not in the emergency room. Urgent care centers treat cases that are crucial but not life-threatening, as you would see in an emergency room in a hospital. Retail clinics are designed for treating patients with less crucial health conditions, as they are to be treated at their own convenience of their own schedules. Retail clinics cannot offer the same services that can be found at an urgent care center. For an example, x-rays would be found in an urgent care clinic, not a retail clinic. Now, after discussing retail clinics in the United States, we have some few questions for you. How are walk-in clinics going to affect primary care going forward? And how has our spending been affected due to the opening of retail clinics?